Hello guys and welcome back to my YouTube channel. This is Dr. Ann. My name is Mary Ann Mathew. I'm from Mumbai. My native is the Kerala and I have studied my BVSc and AH from Madras Veterinary College, Thanuas. I am proud to be an MVCN and yeah, let's go further without any delay to our topic. So today the topic is about pet allergy, how to deal with it and tackle it. So all pet owners, if your pets are suffering from any kinds of pet allergy, this is what you need to do and this is what you need to know. So we all know what an allergy is in a layman's term, but we really need to define it. So I will be telling you today what is an allergy, what are the types of pet allergy, whether our pet owners are at risk with pet allergy, what are the diagnoses, what are the clinical signs, and last but not the least, what are the treatments for pet allergies. So yes, coming back to the topic, what is an allergy? An allergy is basically a condition in which the immune system reacts abnormally, and this happens when substances like allergens come in contact. So this is an allergy. This is what is called an allergy. And now coming back to the types of allergy. So the types of allergy are: there's food allergy that our dogs and cats could be affected with, there's environmental based allergy, genetical issues, there's pollen grain allergy, atopic dermatitis, and also there could be allergies due to fleas, ticks and mites. Very important. So yes, can our pet owners be affected with pet allergies if our pets are having pet allergy? Yes, but not always. Again, it depends from various persons' immune system and the way it responds to the sensitivity. But yes, 90% of the people who have asthma and also breathing distress are more affected because their immune system is kind of little low than the others. Also, an important thing to remember, no all dog and all cats are truly hyperallergenic. Some breeds are just better than the others because they have a higher immune system and so they can tackle it. But some dogs who are having a lower immune system are more likely to suffer from pet allergens. Okay, so yes, any allergic condition that predisposes to develop, it can also develop secondary bacterial infection, like we could say an example as otitis externa. So yeah, that is a secondary bacterial infection caused by an allergy. So an allergy can start basically with a very small itch or a small sign of redness, but then can develop into a secondary bacterial infection later on. So how do we know if our pets are suffering from allergy? Well, before you go to that, you should always get a pet allergy test done from any vet or any pet clinic that you go to. Always ask them if they conduct any allergy testing done, where they'll take your blood and check the proteins to find out if your dog is allergic to nuts. It could be walnuts, badam or anything. Even nowadays, even dogs are affected. I mean, like pet allergy, they have allergies to chicken, wheat products, milk products. So it could be anything and everything. So it's always good to rule out that your pet is not suffering from all these by doing a basic, simple pet allergy testing. Okay, coming to the lesions that we see on our pets. So mostly there would be, I would define this in a very a normalized way, a neutral way where both vets and normal pet owners could understand. So you would get to see papules, boils. You need to find out where do they go, what do they eat, where did they visit these past days, their change in poop and urine. You need to find all these. So basically history is the main goal of finding out what really happened. But obviously you cannot really detect with the history alone. You need to find the clinical signs, the pronounced lesions or erosions that you find on the skin, also by doing blood test, a very important allergy test. You can do a skin scraping or a tape impression. It depends on what the clinical signs are. Also, you could take a little of the hair, check in the microscope, do blood smears. So yeah, these are the different types of diagnostic measures that we have for skin allergy when it comes to your pets. So now coming to one major important part, and that is the treatment. So first that you need to do is, again, which I told you, you need to do an allergy test, which is very important. That could rule out what allergies your dog or cat is affected with. Always also there is another condition where you use a lot of disinfectants, like the disinfectants that you use like Lysol, Dettol, or any chemicals that you use on the floor to clean your floors and house and stuff. So that could also cause skin allergies. So there is a remedy to rule out that. What you could do is you could keep your pet in one room and then clean the entire house with whatever disinfectant or chemicals that you have, and then keep that for a while, and then remove your dog out from the room, let him loose, and then go to the other room and then again clean that particular room where your dog was lying in there. So that is a way you could rule out. Also, bleaching powder causes a lot of allergies as well, so we need to be careful with what we use on our floors. Last but not the least, even whatever they lick and eat, like the rubber toys that they have, make sure that they are not stepped by kids or people. If it's thrown out on the floor or the ground, always make sure that you disinfect it so that they don't really chew on rubbish. Always also do a blood test to rule out any secondary bacterial infections, because sometimes what will happen is you might not know, the clinical signs might have already developed and your pet is already suffering from something really serious and you don't know, but you will only get to know when you see clinical signs, something related to the skin. So that is also always rule out to find out whether your pet is having a fungal infection or a bacterial infection or viral infection. You need to differentiate and segregate things in order to find out what really is occurring in your pet. We can also do a diet management. So there are hypoallergenic, hyperallergenic allergy foods that commercially are available, and those could also like cure whatever your dog and cat is going through. Cure wet or would do is, once they see that it is too severe and it keeps occurring again and again. Skin allergies are a lifelong therapy. It's not really the case in all of the skin allergies, but 90% of them you need to take care of them and manage them well with cleaning your houses and utensils and everything that they touch and play, their houses and their poop litter and everything. What the wet would do is provide you with anti-inflammatories, short-acting glucocorticoids like prednisolone, which is 1 mg per kg per day, cephalosporin group of antibiotics, which is 5 mg per kg per day. And if these don't respond, then so cephalosporin is mostly given if the glucocorticoids are not responding to the animal. Also, we provide them with antihistamines, very important. Now, these are few things that a vet does, but what you could do as a pet owner is feed your dog and cat with a lot of omega-3, omega-6 fatty acids in their diet, like fish and fish oil and stuff like that. The primary drug that we use mostly for any kind of allergies are mostly ivermectin, just for your knowledge. Other than that, we also provide dogs and cats with rid baths, tick bath, flea baths, lime sulfur bath. Proper grooming is essential. Brushing of the hair is very important. So these small theories and the practicality that you actually do and like incur on your dogs and cats will improve their well-being and health life and keep them in a healthy life. Last but not the least, we also use immunotherapy, but that is not really widely used and recommended mostly. But yes, these are the things that are mostly done for the treatments of pet and skin allergies. So yeah, I hope you liked the video. This is the first time I'm gonna post this video about pet allergies. Please like, share and subscribe. Thank you for all your time. Dr. Ann Mathew signing off.